Good afternoon, everyone. Great to have you join us today for this important webinar. As you will hear, we've been doing some work in the area related to veterans' oral health, and we wanted to but we work in oral health policy and systems change, essentially to increase access to care for all Missourians, including Missouri veterans. So with that, I am going to turn it over to Ashley, and I will probably stay off camera. I hope I was stable during that time. I did get a message that I had some web instability just now,
Yeah, it was a
but
little
welcome all.
it
And
was a little garbled,
Ashley,
but
you have
we'll do it.
the floor.
So again, I am Ashley Herman. I'm the Community Outreach and Project Development Director with the Missouri Coalition for Oral Health. So a bit of background on the coalition. We are an advocacy organization focused on oral health needs for Missourians. We bring together partners and stakeholders of all different types to work on improving access to care for Missouri veterans, for Missourians, including veterans and other populations. So today we are going to focus on the status of veterans' oral health within Missouri and share a little bit of background and data regarding what is happening for Missourians, for our veterans, and some opportunities for moving this work forward. So, most of the materials that are going to be shared today are through a collaboration with CareQuest Institute for Oral Health, as well as the American Institute of Dental Public Health, combined with things that we have done here with the coalition, as well as some of the things that our partners have done with the Department of Health and Senior Services and Office of Dental Health. So with that, we'll jump right in. So a little bit of background regarding veteran status and oral health. So most veterans are not actually eligible for dental services through the Veterans Health Administration. So there are approximately 18 million veterans in the United States. Of those, only about half or 9 million receive their health care from the VA. With that, another 1.8 million are eligible for dental care, but only around 582,000 of those 1.8 are actually receiving any form of dental services. So, what does this look like diving a little bit deeper into how veterans are reporting their oral health status? So, we're seeing that about 2 in 5 US veterans are reporting fair to poor oral health status. And this roughly equates out to approximately 8 million of our veterans across the United States reporting that fair or poor oral health. If we go a little bit deeper and start looking at some of the trends, nationally, we're seeing that almost a quarter of our veterans are living in rural areas. And our rural areas present several unique challenges to accessing oral health care as well as accessing general health care services. And looking a little bit deeper, our veterans with diabetes are about 40% more likely to have lost all of their natural teeth, and those with heart disease are about 30% more likely to have lost their natural teeth. So, this is a large portion of our veterans who have chronic conditions and usually multiple chronic conditions that are losing teeth at a much higher rate than what we're seeing from the non-veteran population. If we drill down into Missouri specifically, we know that our veterans make up about 8.6% of Missouri's population. So, with that, of those, about 13% of those Missouri veterans are actually living within a rural county. So, if we start compiling some of these things together, and we know that a large portion of our veterans are living in rural areas that already have issues with access to care, compounding that with veteran status, we start to see that there's a very large problem happening within Missouri for our veterans in order to access the health care and the oral health services that they desperately need. Looking a little bit deeper, so our oral health for our Missouri veterans. Here we have in the purple is Missouri numbers, and in the pink is our national data. And we're seeing that about 20% of Missouri veterans have diabetes, whereas about nationally we have 17% of our veterans who have diabetes. When we look at heart disease, we've got about 17% of Missouri veterans versus 14% nationally who have heart disease and those other chronic conditions. Then we start looking at edentulous status and how many have lost all of their natural teeth. So in Missouri, we've got about 11% who are fully edentulous and 7% nationally. And then if we kind of look on into medically uninsured, these are very similar in terms of Missouri's data versus national, 7 to 6% respectively. But all of this compiled together whenever it was looked at through the American Institute of Dental Public Health and the CareQuest Institute for Oral Health, they gave Missouri a grade of an F for Missouri's oral health status for veterans. That puts Missouri in the top 10 worst states overall. We're sitting ninth in terms of diabetes status with our veterans and sixth overall for edentulous status. So there are big things that need to change within the oral health system for our veterans to start improving these numbers and improving the access to care and the care that our veterans are receiving. So if we go on in and look a little bit deeper, we can see from a 2022 CareQuest Institute report titled Veteran Dental Care Stimulates the Economy and Improves Overall Health, we have found that about 74% believe that the government should pay for our veterans to go to any provider that they choose to get their health care. Of those surveyed, 71% believe that veterans should not have to pay any medical expenses out of pocket. And interestingly, 72%, so a little bit higher, believe that veterans should not have to pay any of their dental expenses out of pocket. Finally, 73% of those surveyed believed that veterans should not pay for any vision expenses. So clearly, the public is seeing the importance of caring for our veterans, those who have given so much to us, and want to make sure that they are being cared for adequately and effectively to ensure their overall and optimal health. There is a mental health connection for our veterans in terms of oral health status. So, about 29% of veterans surveyed from a CareQuest Institute report entitled Veteran Dental Care Stimulates the Economy, they were asked when you are seeking dental health services, what was your barriers to care? And we're seeing that about 56% reported cost and 13% reported no availability. When you couple that into the mental health connection, we have about 29% of those who were surveyed rating their dental health as poor. About 14% or just over rated their mental health as poor. And 10% is showing that they have an overall health status as poor. So we're starting to see the connections here between oral health system status as well as our mental health connections and how all of this is tying into overall physical health and well-being. So what did the Missouri Coalition do in order to help combat some of these issues? We were lucky to be awarded a grant from the CareQuest Institute to help identify some of the barriers to care and start looking at solutions and opportunities to improve the outcomes within Missouri. So with that, the Missouri Veterans Oral Health Work Group was established. So in October of 2024, the coalition brought together over 25 members from various organizations, including academics, public health, general veterans, veteran serving organizations, the Missouri Primary Care Association, Office of Dental Health, as well as many, many others, to start really identifying and brainstorming what are the barriers to care? How can we start to improve some of those? And what can we really do now to work with our partners to continue the improvement of oral health status? So we set out with a purpose to promote recommendations for addressing the identified unmet dental needs of Missouri veterans, which can then be used to advocate for policy changes and pursue additional funding for expanding dental services and mobilize community resources to support veterans in accessing the care that they deserved. So over the past year, all of our partners have continued to meet monthly as a work group, and we've had several outcomes come out of that work group. One of which being a resource hub for veteran oral health projects. So we're lucky at all of our meetings that most of our partners come with things that they've been working on in the past month, and we're going to highlight one of those projects here in just a second. We also developed a policy goal recommendation for the coalition to pursue. So this work group was formed and born out of our policy committee within the Missouri Coalition for Oral Health. And with that, the work group recommended and had approved a new policy goal of expanding access to comprehensive dental care for all Missouri veterans. So what that policy recommendation will allow us to do is to find and continue to pursue opportunities to improve access to care for our Missouri veterans. So one project that we're going to highlight from partners within the work group is the Smiles for Veterans project. And this was a collaboration between the Missouri Department of Health and Senior Services Office of Dental Health, Smiles of Hope, and A.T. Still University, the Missouri School of Dentistry and Oral Health. So this project allowed for students and volunteers to work with Smiles of Hope, which is in Dexter, Missouri, so down in southeast Missouri, to provide low cost and free extraction services for Missouri veterans. And then additional care can then be carried out within the Missouri School of Dentistry and Oral Health. So this partnership project has been going on for a few years now. Smiles of Hope has been around since 2010. This project has seen over 2,000 veterans receiving care, over 1,400 full or partial dentures delivered for Missouri veterans, and over 7,000 extractions have been completed. So a lot of work has been done for our veterans, but there is still so much more that can be done. And we're very excited with this work group to be able to share the Smiles of Hope model as well as this collaborative partnership between the Office of Dental Health and the Missouri School of Dentistry and Oral Health, and hope to replicate that across other areas within the state and serve as that resource and learning hub to really be that convener of partners in order to continue this work and have it move forward in other areas. We know that this is not the end all be all solution for dental care for our veterans, but it is somewhere to start. So looking forward, what else do we have coming up in order for the work to be continued? So the Missouri Veterans Oral Health Work Group will be continued. So this is something that will be held monthly or will be held quarterly, excuse me, via Zoom. We invite all partners interested in veterans oral health to join us and to have collaborative conversations around the status of veterans oral health and how we can continue to moving things forward. The coalition is seeking continued support for our veteran serving projects and looking at ways to incorporate more veteran activities into the daily work and operations that we do. We are also looking at collaboration with national organizations and partners, so such as CareQuest AIDPH, the Oral Health Progress and Equity Network, and various others, since veterans issues are more of a national topic and national policy level. We do need those larger partners in order to help improve overall status for our vets. And we are always looking at ways to continue the improvement of our veteran status. So there is a little bit more here to look forward for. So our 2026 Missouri Oral Health Policy Conference is upcoming in Jefferson City. That's going to be March 5th and 6th. So if you want to go ahead and save the date, there will be lots of information shared there. We may have an update on additional veterans opportunities that are forthcoming at that meeting. And then our few references. We'd like to go ahead and say thank you for attending. I know we don't have a ton of information to share. All of today's information will be recorded and sent out to you later and available on our website as well. So with that, I'm going to open the floor for questions and get some discussion from our audience. So questions can be asked using the chat function or the Q&A. If you would like to be asked to come off mute, you can use the raise hand function and I can unmute your line. I know we have several partners on our call today. So Kevin or Dr. Silva, if either of you would like to share a little bit more detail regarding the Smiles of Hope program, you are welcome to raise your hand and I will unmute you. me one second here. Dr. Silva and Kevin, you both should be able to unmute and speak.
Testing 1, 2. Can you hear me okay?
You are good.
Okay,
Yep, I'm here as well.
I don't know about good. You want to go first, Kevin?
No, go ahead, Doc.
Okay, well, just some observation. Our Smiles, or the Smiles for Veterans program, certainly associated with the University, Missouri School of Dentistry and Oral Health, got started off of our dentistry in the community missions to Dexter, where we just started taking teeth out. And that, for me, that started, I believe that's when it started, was 2016. And from that 2016 experience of just going down there to help them with their acute needs and extractions, uh, with Kevin and I, we started to put the puzzle together to say, hey, let's put a proposal to the university to see those folks that needed dentures. So we started initially. It was called the Smiles, the Dentures for Veterans program, if you will, the Missouri Veterans Denture Project, if you will. After a bit, the dean got on my butt and said, hey, wait a minute, we do stuff other than just take teeth out. So it changed. We started doing partial dentures. It has since now become a component of the overall education of the students. Your data, we've seen the 2,000 veterans. We've seen more than 2,000 veterans at school. I'm guessing that in the 1,400 arches that we've delivered at school, of that, I would guess about 20% of those numbers are then actually done on veterans from the Dexter area, whether they come up to the school or we've done very few adjustments and so forth there. So it's a slight variation, if you will, in the theme. What's going to happen down the road in the future with the project that Dexter's going to get to with their new clinic, and however all that stuff will be a part of it, remains to be seen. But again, the issue is we still try to clamor from different resources to offset the expenses. Those 1,400 arches plus, we delivered another case this morning, so maybe it's 1,402. I'm joking. That free dentistry to the veterans costing somebody some money. So the money comes from other donations and sources, and such that we keep that bucket rolling. And thanks to those who have participated in that regard. I'll shut up.
Thank you for that additional background, Dr. Silva. Kevin, what can you add for us?
Well, I will add a little bit. In conjunction with Dr. Silva, we have numerous veterans that are served outside of MOSHTO's participation. We do have a monthly clinic here, and while we would love to have MOSHTO here monthly, they're not able to do that. Hopefully, with our new facility coming online, we'll be able to have them, hopefully even on the daily, perhaps, but we'll see how all that pans out. Doc Silva's son up in Chesterfield, he offered a couple veterans from down here implants to hold their dentures after MOSHTO had made their dentures, and that seems to be a very effective thing. Of course, Doc Silva, the younger Doc Silva in Chesterfield, he's probably not in a capacity to offer that, extended for veterans. But if we could do perhaps some outreach and find somebody that could, those implanted dentures seem to work extraordinarily well. I don't know. I'll yield to you, Doc Silva, for any input you may have on something that even if they had to travel, I'm sure they'd be willing to.
And again, the background for that was it was Nobel Biocare that went out and had a root beer with that guy, and Nobel Biocare has been donating the implants, and John donated his time and service. I think we've completed he's probably got the numbers. I'm guessing somewhere in the vicinity of 30, maybe 35 veterans that have taken dentures that we've then fabricated here at school. And it's only been the lower arch to date. We do 2 implants and do 2 locators in the lower arch, which turns it from being a total piece of crap to something that's tolerable and functional to a much greater degree. The O-rings and the anchors and so forth, of course, that has to be replaced. I've been on my spiel with our students here. Free dentistry is not free. Somebody's paying for it. And so, we get the donors that have done that stuff. John, God bless him, has just put in he's not going to have quite as many chairs as you, Kevin, I think, down the road. But I know he's got 14 chairs in his new clinic, and who knows if we'll start doing some things with that. But again, we started with, acute care. Well, as soon as you start getting into comprehensive care, which I put my faculty members hat on, that becomes a different puzzle. I've got a call tomorrow with I got to do the acronym right, E4V, Everyone for Veterans, is an organization out of Portland. They've been around for quite a bit of time. Dr. Cheng, who's a former humanitarian award from International College of Dentists. And basically they have continued to do what the ADA, I think, has just started with their Smiles for Veterans program, with identifying volunteers, licensed practitioners who will take on a veteran, one a year, one a quarter, one a semester, whatever, however you want to do, whatever, and they bear the brunt of that. That free dentistry being provided by that practitioner rather than the individuals. So again, donated dental services is a similar thing, although they don't specialize just in veterans. Everyone for Veterans is just veterans. The ADA, again, they had a big thing at their last meeting, whatever it was, down in New Orleans, type of thing, and they raised a bunch of money. But I think the money is to pay for the administration of the project, not so much to offset the expenses as to what's being provided by the practitioners. So,
Hey, Doc, that E4V, is that the organization that you told me Paul Roberts from MDA was involved in?
yeah, they just started. They're around the country, and apparently, when I've met with Dr. Cheng a couple of times in the past, she's aware of what we're doing, and we're posting good numbers comparatively around to the other country. What doesn't seem to have been, and Paul Roberts got the EV4 people got a couple of outlying state participants that wanted to know, hey, what do I do? Veterans that needed treatment from, I don't know where they were from, Springfield or Columbia or Kansas City or whatever. And the question is, now what do they do? And as far as I know, Joplin, KCU, and UMKC does not have the program similar to what we've got. I keep trying to knock on some doors in that regard, that students need to get these procedures to graduate. I got an idea. The veterans need the treatment. All you got to do is find somebody that's paying for it. I don't know what their fees are. I went and I did a quickie seminar down in Joplin, and of course they're only in their 3rd year of their program. So their students will now become, they'll now start looking for patients that need that kind of stuff. So one of the things that Paul Roberts was doing, and again, I spoke with him at the Mid-Continent this past week, that, what do we do with the veterans that get identified? Well, we refer them to, hey, they're welcome to come to Dexter. They're welcome to come to the school. But, we don't have secretaries. I mean, it's a little bit awkward. So that word needs to get out. And the coalition has been great with sharing the stuff. I'm looking at some of the stuff. Send us an email and we'll get you involved. Yeah. That's the thing. You get the rural parish clinic. Yeah, those guys have been terrific, and they do stuff on their van and so forth. But that's kind of like what you guys started out down there. You're going to be limited in numbers, or they're going to be able to do stuff and they go to the VA homes. So again, I get talking too much. Sorry, I get on my soapbox.
No, thank you. Katie, I moved you over to be able to speak a little bit about rural parish and the things that you're doing to serve veterans.
Yes, thanks. So I put in the chat, the Rural Parish Clinic absolutely can serve veterans. They must be uninsured, which we know most of them are. And just must be under 200% federal poverty level. So we're in 6 rural counties surrounding St. Louis City, so limited to this side of the state, but patients can come to us no matter where they live. So we do have patients that travel because location is not part of the criteria. We're fairly comprehensive care. We are currently not doing root canals and crowns, although we are exploring the idea. But we provide exams, hygiene care, education, fillings, extractions, and partial and full dentures if indicated. So, and then also if they still qualify, they're welcome to come back for recalls, and we try to catch up with them every 6 months or so if they still qualify.
So those are just two great examples of the work being done within Missouri with some of our partners from this work group in order to help make a dent in the access to care issues that our veterans are facing. And we still have plenty of time for questions, so please continue to drop those in the chat and in the Q&A. If anyone would like to come off mute and ask their question live, use that raise hand function and I will unmute you. While we're waiting for a couple more to populate, just a reminder that this is being recorded today and will be posted to our website. A copy of the slides and the recording will be sent out to you post-webinar. We'll also have a post-session survey to complete in order to receive your CE for today. So one dental CE credit is being offered for today's webinar. That post-session survey was just dropped in the chat. You will again get that in an email as well if you don't have access to the chat right now. I'm just waiting for any more questions or comments to pop in. I don't, Gary, do you have anything else you want to add, or anyone from Office of Dental Health, would you like to speak up in terms of your involvement with our work group and the opportunities that we've been working on?
So I was just going to mention, not just about veterans, but we're constantly working to try to get better coverage through whatever vehicle we can. And we do a lot of work with Missouri Medicaid. We did identify a policy change that we think that would be very helpful for the general adult population, which some veterans are certainly eligible for Medicaid in that category. And we have requested through the Dental Advisory Committee that for that population that they cover stainless steel crowns. That was not shot down immediately. There was good discussion about it, and basically Mo Health Net said we're going to go look at that and cost it out. We haven't heard anything back from them, but that adds an extra tool, a covered tool for people that are in need with crowns. We did have a lot of discussion about stainless steel crowns and the weaknesses of them and all that, but we thought that even in the current context where the state's looking at cuts, we thought we had a good argument for it. So we'll see. I just wanted to make everybody aware of that.
Definitely something worth highlighting. Thank you. I am not seeing any additional comments or questions come in. If things do come to mind after sitting with today's information and reviewing it a bit more, you can reach out to info@oralhealthmissouri.org or myself. We're happy to provide more information, get you involved with the work group, and help keep moving this mission forward. With that, I will end today's recording and thank you all for attending. The post-webinar survey has been dropped in the chat. Again, you'll receive that in an email as well. That's to earn your one dental CE credit for today's presentation. And I thank you for everything that you do for Missouri Oral Health and look forward to talking with you all again soon. Have a great day.